Hello, everyone. My name is Jacie Gibson. Welcome to this presentation on healthcare delivery in the United States and equity. I'll explain providers' care settings and purchasers and show how each impacts fairness in healthcare. The U.S. system is a complex mix of public and private care. Understanding it is important because it explains both strengths like advanced technology and weaknesses like inequities in access. Providers' equity issues. While providers are central to care, they are also linked to inequities. Rural communities often have fewer providers, creating shortages that limit access to essential care. For example, someone living in a rural county may have to drive hours just to see a primary care physician. In addition, bias in care, sometimes unconscious, can lead to disparities in how treatments are recommended or delivered for racial and ethnic minorities, as highlighted. On the other hand, providers can also help reduce inequities. Cultural competence training allows providers to better serve diverse patients, while telehealth expands access to specialists who may be hundreds of miles away. Outreach programs in underserved areas also create opportunities to close gaps in care. Care in the U.S. is provided across many settings. Hospitals handle emergencies and surgeries. Outpatient clinics provide routine and preventative care. Long term care supports elderly and chronically ill patients, and rehab centers focus on recovery. Care can also take place at home through home health or in community clinics that serve vulnerable groups. Just like with providers, inequities appear across care settings. Facilities are often clustered in wealthier or urban communities, which means rural or low income neighborhoods may not have easy access to hospitals or specialty clinics. This unequal distribution leads to worse outcomes for people who must travel long distance or face long wait times for services. Ortega and Ojera show that these access gaps contribute to ongoing health disparities. However, there are solutions. Federal qualified health centers bring affordable care to underserved areas. Telemedicine is another tool that has grown rapidly, and especially after the COVID-19 pandemic, and it allows patients to remote areas to connect with providers virtually. These innovations show that while the system can create inequities, it can also adapt to address them. Healthcare financing in the U.S. is just as important as care delivery. There are three main purchasers: private insurance, usually tied to employment, government programs like Medicare and Medicaid, and individuals paying out of pocket. This mixed model makes the U.S. unique compared to other developed nations that rely on more unified systems. Equity problems are very visible when we look at how care is purchased. Since private insurance is often tied to employment, people who are unemployed, underemployed, or working in jobs without benefits are more likely to be uninsured. Medicaid provides a safety net, but eligibility and coverage vary by state, leading to gaps in access for millions of people, as noted by the National Academy of Medicine. On the positive side, federal programs have created incentives to improve outcomes. For example, the Centers for Medicare and Medicaid Services introduced the Hospital Readmissions Reduction Program, which reduces payments to hospitals with high readmission rates. This policy encourages hospitals to improve quality of care and indirectly helps reduce disparities by focusing on patients who are most at risk of being readmitted. In conclusion, the U.S. healthcare system is one of the most advanced in the world, with cutting edge technology and highly trained providers. However, it is also fragmented, expensive, and unequal. Inequities appear at every level among providers, within care settings, and across purchasers. The result is that some populations enjoy excellent health outcomes while others continue to struggle with access and affordability. To move towards equity, reforms must focus on expanding coverage, ensuring culturally competent care, and addressing the social determinants of health. By improving fairness in how care is delivered and financed, we can build a system that works better for everyone.